Hello and welcome to this week's edition of Healthcare Heroes, where we recognize our dedicated frontline staff and managers. I'm Sandy Potter, joining you today from my home studio, along with Masonicare President and CEO, Venoit, and our infection prevention and control team at Masonicare Health Center, Sierra, Stacey, and Crystal. Thank you all so much for your time today.
Thank you for having us.
Ladies, you've been doing tremendous work over the last several months now to protect our residents, our patients, and our fellow team members during the COVID-19 pandemic. Can you tell everyone what you've been doing on a daily basis to monitor and enforce the safety guidelines?
Well, I can say that it's 100% COVID 100% of the time. Being involved in all the online education, we rely on Leading Age to help us work through some issues. We're on the CDC site daily, and we take our guidance from the Department of Public Health as well. So I think it's just keeping up to date on all the guidance that's coming out and reflecting such guidance in our policies.
So we are monitoring staff every time they walk into the building, checking temperatures. We're doing a screening with them every single day, every single shift. We are monitoring residents every shift, taking their temperatures, checking their respiratory symptoms. We have also done 2 rounds now of resident testing where they're having swabs done for lab confirmation, whether they have COVID or not. And we started our staff testing yesterday, so that's been going really well. So far we have 85 results back and they're all negative. And lots of meetings, like Sierra said, conference calls, all COVID, all the time.
Another important thing that we're doing is educating the staff, making sure that they're caught up with all the CDC regulations and that we're following our policies, so that as that changes daily, we're making sure all the staff is aware.
It's a huge job, and you really have done just amazing work. JP, I should have introduced them as our dream team, I think. I know you're so proud of their tireless efforts.
So one of the really important things that I'm seeing right now is 3 individuals that I can actually see their faces for the first time in 3 months, a little more than 3 months, and it's great because to see their smiles. The last 3-4 months of COVID has been extremely stressful, and even though I couldn't see your mouth, you could clearly tell you were stressed, but dedicated to making sure that you did what was right for our residents. And the results have shown that we've done a great job, and the dream team here has done a fantastic job at staying vigilant. They all 3 of them said this, very much the same thing. We are still in COVID time. We are still staying vigilant. We are still pushing to make sure that we're taking care of our residents and keeping them safe. And this has been a challenging time for us, but it's also been a time for us to recognize and realize how great of an organization and how great our staff are, and the leaders that you're seeing here today, to make sure that we are doing what we need to do. And every time I walk in there, I'm amazed at how the staff really have stayed upbeat, but also have realized that we are doing it right. And it's thanks to really all 3 of you for what you've done. The educations, the texting, the emails, the meetings, it's a lot. There's a lot of information there, but you've done such a great job at making sure our staff know what's happening and staying on top of making sure that we don't have that outbreak. And I think that's something I'm extremely proud of. But I will say, seeing the 3 of you right now without masks, actually, it just dawned on me as you were talking, to see you, the 3 of you without masks. It just warms my heart because I can see your smiles, and that's not something I've had the luxury to do with any one of you over the past few months with those wonderful masks that we have to be. The right thing to do is to have the masks, but it's great to see the smiles, recognizing that you've done such a great job.
Thank you.
Thank you.
Absolutely. And ladies, I wanted to ask you as well while we have you, as we continue into these summer months, where I know we're being very careful not to lift our restrictions too soon. Can you tell us where we stand as of now at Masonicare Health Center?
Well, per the CMS guidance, we are still in phase 1. In order to move into phase 2 for reopening, the staff testing needs to be initiated. So we're in that process now. This is week 1 of staff testing, and we will do it weekly until we have no positives among the resident and staff population for 14 days. And that was actually clarified today that we would only have to do it twice and not 3 times. So everything's changing all the time, and we are being vigilant with our infection control processes in order to be able to reopen sooner rather than later. Everyone needs it. I think it'll be an uplifting experience for the residents and the staff as well.
Absolutely. Well, thanks to all of you for sharing time with us today and for your commitment to maintaining a safe and healthy environment for our entire community there. We're so lucky to have you, and you are, as JP says, definitely Masonicare strong. Thanks so much for watching at home, and we hope you'll join us next week for another edition of Healthcare Heroes. Until then, be well.
Thank you.